So here they have asked for 3 marks the coracoid process. Coracoid process. Okay, so where do you see this? This is anatomy theory paper, final MBBS first year. So coracoid process, they're asking for 3 marks. So coracoid process. So this will be in the scapula. Okay, so this is upper limb question. So here you can see this portion, this red dot, okay, exactly where it is in your scapula, this portion. This is the coracoid process of the scapula. Earlier in our ancestors, this coracoid process was an independent bone, but then it has gone and joined the scapula in humans, okay. So that is why this is it is called as an atavistic type of epiphysis. Epiphysis is end of bone. This is an atavistic type of epiphysis. The coracoid process is the atavistic type of epiphysis of the scapula. Remember, it was there in ancestors as independent bone. Now it has become the end of the scapula. That's why epiphysis. Okay. So coracoid is what is it? It is an atavistic type of epiphysis of the scapula. It is a process. It's a part of the scapula in humans. Okay. So it will appear in the first year. It will come when in the first year itself in the baby there will be a coracoid process, but when will it fuse with the scapula? 15th year. Okay, you have to become at least 15 years for this coracoid process to be joining your scapula. Okay, so this is very important to know, so you can determine age for that person, right? So I want to highlight this, but I'm not able to highlight. Okay, anyways, it fuses by 15th year. Remember, guys. Super, 2 words. Atavistic type of epiphysis appears first year, fuses 15th year. This much you have got. Now let's move on to muscles. Muscles that originate, we are showing in muscular color, that is brown. Biceps brachii, short head. Okay, and then coracobrachialis. 2 muscles, only 2 muscles we have written here in brown. Biceps brachii, short head, originates from this coracoid process of scapula. Coracobrachialis, obviously the name itself suggests it comes from coracoid process and inserts into the humerus. Okay, coracobrachialis also, it originates from this coracoid process. 2 muscles you got. 1 muscle biceps brachii, 2 muscle coracobrachialis. Move on to the third muscle here that is getting inserted. Pectoralis minor inserts. Pectoralis minor inserts into this coracoid process. So 3 muscles you have learned. Now let us move on to, guys, the next part. Muscles over. Now ligaments. Okay. Now ligaments. What and all ligaments are there? Coracoacromial ligament. We'll use green, right? For ligament they are using green. So we'll also use green. Coracoacromial ligament. Then coracohumeral ligament. You know it. The name itself says coraco. Coracoclavicular ligament. Excellent. Then lastly one, clavipectoral fascia. Okay. Is also you have to remember. Okay. So 3 ligaments are there and then 1 fascia is there. From coracoid process to the, look at this diagram here. From coracoid process to the, this is coracoid process to the acromion. You have what? Coracoacromial ligament. From coracoid process to the humerus. Okay, somewhere here humerus will be there. Coracohumeral ligament. Then clavicle. Clavicle will be going somewhere here like this. It will be going. Okay, so there is a coracoclavicular ligament. 1 more ligament. So 3 ligaments we mentioned. Coracoacromial ligament, coracohumeral ligament, and coracoclavicular ligament. Okay. Then clavipectoral fascia. It is also attaching, that fascia also attaches to this coracoid process. Okay, laterally to coracoid process. Let us look at clavipectoral fascia. See, where is the clavipectoral fascia, guys? Here you can see this is human's face. So somewhere in the thorax. So here you're seeing that this is a clavipectoral fascia. It is enclosing a pectoralis minor muscle. And here this clavipectoral fascia is attaching to this. They are saying coracoid process of scapula, right? Do you see it attached to coracoid process of scapula? They are saying it is attaching, so we'll believe them. Okay. So majorly it attaches to clavicle. Okay. but little it is attaching to our coracoid process also. So here you have the clavicle anterior view you can see, and here you have the coracoid process. So this clavipectoral fascia slightly in the lateral part of it is attaching to the coracoid process of scapula. Okay, so you have understood coracoid process now, right? Which are the three muscles you will mention? Bicep brachii, short head, very good. Then coracobrachialis. These two will take origin. The insertion will be of the pectoralis minor, which are the ligaments coracoacromial, coracohumeral, coracoclavicular, and then you have one clavipectoral fascia also, which attaches to it. Okay. Just in case you did not see the short head of tricep, this is the short head of tricep. So follow him. Where is he going? He's going to the coracoid process. Okay. See, coracoid process is marked here. So this is the coracoid process. Who else is there here? This guy is, you can see here, coracobrachialis. This guy is coracobrachialis. Where is he going? I mean, where is he originating from? From the coracoid process. And who is inserting into the coracoid process? This is the pectoralis minor. Guys, pectoralis minor marked here, pectoralis minor. Okay, so these are the three muscles you should know. Okay. Bye-bye.